Teen dies months after his brain cancer is misdiagnosed as ear infection. Devastating. In October 2024, Jack Sexton started experiencing severe headaches, double vision, slurred speech, and complete loss of balance. After multiple doctor visits, the 19-year-old from South Wales had his symptoms dismissed as an ear infection from a recent bout of glandular fever, his family explained in a GoFundMe page. He was prescribed antibiotics and sent home. However, days later Sexton was at home when he collapsed and was rushed to Prince Charles Hospital and given an emergency CT scan. The family received devastating results and Sexton was diagnosed with glioblastoma after an inoperable tumor was discovered within the brainstem. Glioblastoma, also known as GBM, is a rare form of terminal cancer that kills more than 10,000 Americans a year, according to the National Brain Tumor Society. It is the same type of cancer that Senator John McCain died from in August 2018. The disease has no known cure and standard treatment involves surgery to remove the tumor, if possible, followed by radiation and chemotherapy. Those who are diagnosed with the malignant tumor have a median survival rate of about 14 to 14.5 months. Treatment for this type of high-grade cancer was rarely offered, but with Jack's young age and good health on his side, he underwent an intense 6-week course of radiation, finishing just 2 days before Christmas, his family shared. The intensity of the radiation took a huge toll on Jack's health. He lost his ability to walk, especially the use of his left side of his body, was extremely fatigued and had difficulty swallowing. In January, Sexton was home when he aspirated, stopped breathing and collapsed. By the time he was transported to the hospital, he was put in a medically induced coma. Doctors told his family that his condition was critical and he was at risk of suffering severe brain damage or heart failure due to the lack of oxygen. However, by a miracle and the fight left in Jack, he responded well to treatment and was gradually taken off the sedation. He showed good signs that no damage was done to his brain and his lungs began to heal from the collapse, the family said. In all his 30 years, the ICU doctor had never seen a case like it or an outcome so positive. Sexton was later transferred to Noah's Ark Cancer Centre at the University Hospital of Wales, which provides palliative care for children with life-threatening illnesses. He remained there for 5 weeks before returning home. On February 28, the family announced that Sexton died at home, surrounded by his loved ones. After the most heroic fight, against the toughest of illnesses, our warrior Jack heartbreakingly passed away peacefully at home on the February 25, they wrote on the GoFundMe. Jack's amazing personality and sense of humor remain with him, despite his illness, and is something that we as a family will forever cherish.